So I'm Nuala Helsby and I work in the Department of Molecular Medicine and Pathology, which is part of the Faculty of Medical and Health Sciences. So there's a drug that's commonly used to treat gut cancer, and it's called 5-FU or 5-fluorouracil 5-FU, and it's given as an intravenous dose or as a tablet form called capecitabine. And it's a really good drug for treatment of gut cancers, but there is a problem that some people seem to be particularly vulnerable to some of the side effects of the drug. So there's a whole spectrum of side effects. Most people don't get very severe side effects, but there's a proportion of patients that seem to be particularly vulnerable. So the proportion of patients who are particularly vulnerable, the side effects can be very, very severe, and you're hospitalized. So you're in hospital for a long time, potentially, which obviously in of itself is going to impact your quality of life. But there is a small proportion of those people who will die from these side effects. What we're trying to do with this THYmine 2 study is we've developed a test that we can use to pre-screen patients to see if we can identify those people who are particularly vulnerable to the side effects before they take the 5-FU, so that in the future, if we can identify those people, we can give those individuals a lower dose of 5-FU, so it's a safe dose and still effective dose, and avoid some of the side effects. But on the grand scale of things, if we can predict with a pre-screening test who's most vulnerable before they have their first dose, we can do that. The clinicians can do that dose adjustment, knowing that they are giving the best possible dose of 5-FU that will give them good clinical outcomes without any risk of side effects. It's as much trying to make sure you've got all the benefits with none of the harms from the beginning of your treatment. So we've already done one small study in New Zealand and published that recently, and that did seem to be suggesting that we were getting something like 80% of the correct answer, that we knew that these people are the ones that are vulnerable for toxicity, which is reasonably good for a diagnostic test, but it was a small study. And being a good scientist, you'd never just do one study, you do it again. And this is where the Gut Cancer Foundation have been really helpful, giving us some top-up funds to help with this bigger study. So that's one of the many things you have to do with a clinical trial. You have to work out from your preliminary data that in our case was statistically significant, but to repeat it again and to have strength in your findings, you really do need the size of a study to it not just be an interesting preliminary finding, but something that has validity, that has the clinical evidence for them people to consider changing practice. And again, without that Gut Cancer Foundation money to help us extend the study, we just wouldn't reach the required number of patients to make the whole study worthwhile. So it's been a really key thing to be able to have an extension of time. Absolutely key, and it's really key a lot of the time either for top-up funds for something else, or just giving you that initial seed so that you can really make sure that you've got the evidence, the preliminary evidence, to make somebody else throw a lot of money at it, because clinical trials cost a lot of money.